We are ready. So I'd like to welcome the resource persons. Thank you for participating in this dialogue. It is important that we know where we are and where we are going in this time of multiple problems, especially in the mutation of COVID-19. So there's a news. I usually listen to an international news roundup every evening, and I had the opportunity to listen very carefully the discussion of the new variant COVID-19D. So we need your advice, and it could spell the agony or the happiness of the Filipino people. This is something which I cannot decide alone because I am not a medical person, and I would need and welcome every advice that I can get from everybody who has the good grasp of the problem. So we begin today with a discussion of, before you have a report, Secretary Duque.
Mr. President, I would like to respectfully suggest that since you have opened up the matter of the variant, the Delta variant, the COVID-19 Delta variant, and we have the technical advisory group of experts, Dr. Edsel Salvania, Dr. Ana Onglin, and Dr. Isa Alejandria, joined in also by the head of the Philippine Genome Center, UP National Institutes of Health, Dr. Cynthia Saloma, and also Dr. Eva Cutionco de la Paz. These are all the members concurrently constituting the task force on COVID-19 variants. And now, the most alarming of the variants, as we all have been informed about, is the Delta variant. So, Mr. President, if I may just ask that we recognize Dr. Edsel Salvania to make the presentation on the Delta variant.
Dr. Salvania, kindly.
Thank you, Mr. President. I would like to acknowledge what you had mentioned, that the Delta variant is really very scary, and this is all the more reason why we really should police our borders po. Kasi it only takes one variant to get in, and then pwedeng mag-India-like surge po tayo kasi mataas po talaga yung number of people na kayang i-infect ng isang taong merong Delta variant. Kung yung dating virus po natin, yung original virus, dalawa lang po yung nai-infect, itong Delta variant up to 8 po. So it's up to 4 times more contagious than the original virus from Wuhan po. So this will really be a big disaster if we do not keep it out of the country po.
I am willing to listen, and you can go with your presentation. We are very happy to hear from you.
Thank you, Mr. President. Basically, this is a short talk about how we can keep the variants out, including the Delta variant po, and why our quarantine recommendations are going to protect our borders po. But basically, the rationale for our 10+4 strategy, as you are aware, the 10 days in facility quarantine upon arrival, and we test on the 7th day, and then we have 4 more days of home quarantine, is really designed to protect our country against the any COVID that is coming from abroad, because it takes about 14 days for COVID to show itself kung matagal na po. Kung hindi pa po siya nagpapakita on the 14th day, most likely wala pong talaga COVID yung taong yon. But if they get infected at the time of arrival, then if we keep them in the quarantine in the facility for 10 days, at least hindi nila mahahawahan yung mga kasama nila sa bahay. By the time we release them on the 10th day, they are almost no longer contagious. Now, ang problema po, if they try to test them on arrival, almost certainly, kung nahawa yung person na yon in transit, hindi pa po magte-test positive yon. So, arrival testing is not recommended by the technical advisory group, and this is why we test it on the 7th day, para kung nahawa man sila in transit, we have a good chance of picking it up. But more importantly, if we do not release them until the 10th day, even if our test did not work, the chances that that person will be able to spread into the community, even if that is a variant, is very, very low. And then dinagdag pa po natin yung 4 days na additional na home quarantine para yung 14 days po na original, as you had mentioned, will be followed. Maybe I will try to share my presentation kasi yung ano po, kasi hindi na ano.
We have the syllabus of your chart. We are following
okay,
you.
sige.
Andito.
Okay po, sir.
We were provided
sige
with
po,
the
sir.
syllabus.
Okay. Sige, sir. So, yung 10 plus 4 po, as I had mentioned, yung ano po kasi, on the slide that shows yung RT-PCR result, you can see naman po that day 1 to 3 of exposure, the RT-PCR will not be positive at all po. And then it is only on the 8th day where there is the highest chance of testing positive. But again, it is really the 10th day quarantine that lowers the risk. Kasi po, itong graph po na nakikita nyo, which is from the Centers for Disease Control, yung blue and purple po are what tells you what is the risk of transmitting to somebody if you only do 1 day of quarantine, 2 days of quarantine, 3 days of quarantine, all the way to 10 days of quarantine, assuming somebody is infected in transit. And you can see po, on the 10th day, halos zero na po yung risk na makakahawa ang isang tao. But if you release them on the 3rd or the 5th day, mataas pa po yung risk talaga, more than 20% to 40% the shorter you go. And then po, this is really worth it kasi there is really no risk of exposing the family as opposed to sending them home after doing arrival testing. And we know that arrival testing will miss up to 60% of the cases because the people might not test positive with RT-PCR yet kasi ano po talaga sila, false negative, masyado pa pong maaga. And of course, we need to keep out the Delta variant, which is very dangerous. So yung sa Taiwan po, ang nangyari, hindi pa to variant yung pinag-uusapan natin. Yung nangyari was they shortened the quarantine of their pilots from 5 days to 3 days and nagkaroon po talaga sila ng outbreak. And this is really bad because ngayon, alam naman natin, Taiwan did very, very well. And what ended up happening was that they were, they now have a surge. And this is because they shortened the quarantine.
Shortcuts.
And
that's the problem with shortcuts.
Yes po, Mr. President. And then, yung variants of concern po, yung pinag-uusapan na po natin na Delta, yung po yung latest, 4 na po ang ating variants of concern, Alpha, Beta, Gamma, and Delta. Wala pa po tayong community transmission ng Gamma at Delta, and we really want to keep it that way. And that is why very important po yung stringent protocols natin. Yung Delta po, as I have mentioned, is 60% increased transmission over Alpha or yung UK variant, which was already 60% increased transmission over the original virus from Wuhan. So mabagsik po talaga to. If we thought Alpha was mabagsik yung UK variant, mas mabagsik po itong Indian variant, yung Delta. And of course, there's also the finding that yung mga partially vaccinated, yung 1 dose pa lang, nahahawa pa rin po sila kasi mukhang itong Delta really needs 2 doses para maprotektahan po ng maayos. Yung 1 dose po is not very good at protecting against Delta. In the Philippines po, we've already had 17 cases of Delta, pero all incoming travelers po, and the protocols that you have approved have caught all of them po. So we have to continue and make sure that this is implemented nationwide because pwede po talaga tayong malusutan if we do not implement this strict protocol in all our borders because again, it only takes 1. And so we have to be cautious po with our quarantine rules. Sabihin ko rin po kasi yung napag-usapan yung face shields, the Delta variant is also 40% more infectious outdoors, 60% more infectious indoors. So it would be nice po to have an extra layer of security na even if hindi naman required, the TAG will still recommend to continue to use face shields even outdoors, especially with the threat of the Delta variant. And of course, we do consider the hardships of our OFWs who are fully vaccinated na matagal po talaga yung quarantine. But it is something that we have to study very carefully, especially with this new threat of the Delta variant. Thank you very much, Mr. President.
Salamat po, Dr. Salvania. Alam mo kasi, when I mentioned about the face shield, I was only shooting the breeze with the congressmen, members of Congress over there. I never said with finality that we will do away with the face shield. Now, I will agree with you, considering that this D variant is very aggressive and it can proliferate in so much short period of time. We may experience a second wave much more serious than the first. Ang problema dyan is I do not think that it will require the same vaccines that we are using now. The scientists, you people, you have to come up with something to fight COVID-19D. Wala pa tayo niyan. Second is we cannot afford it. Yung nangyari sa atin yung first wave, it has depleted really the resources of government. Now, another one would be disastrous for this country. That is why the stricter you are, the better. I'd like to tell you now, total, ikaw ang nauna na nagsalita, we will retain I will apologize to the Filipino people that this thing was being discussed openly, and many thought that we were ready to do away with the face masks. But with the kind of aggressive infection that poses a very grave danger to, it's a small inconvenience actually. I know that it is inconvenient really to be wearing the mask, adjusting it from time to time. But that is only a very small price to pay. Than rather gamble with doing away with it and courting disaster. Kasi ang transmission, it's accepted by all that it be transmitted to the eyes and to the nose. So I'm left with no recourse but really to adapt your recommendation. But I'd like to tell you that beforehand, while I said, reviewing the international news, nung narinig ko ito, I said, baka nagkamali talaga kami discussing about this in public. Because people thought that it was a done deal. No, it was not. It was just a casual chat. As of now, the face mask is on. Wala tayong magawa. The face shield. Importantly, the mask. Yun na lang ang pangkontra ko kasi it is to the national interest I said that we must triple our effort because I said we do not know if it would require a new vaccine which has to be invented first. And second, we cannot afford a second wave because it might be far worse than the first. And then you will have a problem of our economy. And I said it would be a disaster for the country. Yes,
Sir, Mayor, clarification lang po. Kasi yung naging apela po ng IATF is para sa mandatory wearing of face shields in enclosed indoor spaces of hospitals, schools, workplaces, commercial establishments such as but not limited to food establishment, malls, public markets, public transport, and terminals and places of worship.
I'm doing away with that. That was just a suggestion, actually.
Oh.
It was put into writing, but it never came to my... wala sa table ko.
Opo.
And I said, long before that, they were reduced in writing, maybe, yung mga narratives nila. I was really bent on restoring the mandatory use of the face shield.
Indoors
Kasi-
and outdoors po.
Kasi takot ako.
Opo. Indoors
So-
and outdoors po. Na para malinaw po.
Lahat. We go back
Lahat
to
po.
the normal before. So, balik talaga lahat.
Mr.
And
President.
itong quarantine must be strictly followed.
Thank you, Mayor, for the
No
clarification.
exception. No exception. Whether or not vaccinated somewhere else, it would depend on the medical persons to decide on what to do with them. Now, you can present the next speaker.
Mr. President, just to raise a clarificatory point. The IATF resolution on the wearing of the face shield will now be enforced as is, sir, yung dati natin na resolution, sir. So that means outdoor and indoor. Yung sa outdoor, yung as enumerated by Sec. Roque will stay, Mr. President. So basta malinaw lang po tayo kung ano yung dating IATF resolution on the mandatory wearing of the face shield stays, Mr. President.
Well, I'm constrained really to go back to the old practice because of this danger posed by the D variant. Kung wala lang sana yan, especially I said with the narratives that goes with it in the international news and even dito sa locally, it's scary. So, I cannot afford to place the nation, the national interest of the republic by just, sometimes adopting this and being lenient to this. I said, I know that it is a very tedious, if you may, but it is really to prevent a disaster of our nation. So, Secretary Duque, who's your next resource person?
Yes, Mr. President, if the issue on the wearing of the face shield has been resolved, although of course we have our, they prepared a presentation on why it is important to continue with the policy of the face shield wearing. Would you like to listen to that presentation, Mr. President?
Yes, of course.
Okay, Mr. President,
It would be good.
may we have Dr. Anna Ong Lim and the other members of the TAG to make the presentation?
It will further our education somehow.
Yes, Mr. President. Thank you so much, Mr. President.
Thank you po, Mr. President, and good evening,
Good evening,
to the
ma'am.
rest of the attendees. This is Dr. Anna Ong Lim. Are you seeing my screen?
I see you.
Kita na po yung screen.
Hmm.
May I request the Secretariat to please present it?
Yeah, the PowerPoint is there.
Okay. I think we need to go back a couple of slides. So on behalf po of the Technical Advisory Group composed of myself, Dr. Salvania, and Dr. Alejandria, I've been tasked to make a short presentation about the face shields. And just to start off, meron po tayong several na policies and resolutions na kailangan pong balikan. So last December 2020, the Interagency Task Force for the Management of Infectious Diseases under the Resolution number 88 mandated the wearing of face shields whenever people would go out of their residences. And this is because it was known to be effective in reducing the risk of transmission between persons. It was available and it was also low cost as an intervention. And following these issuances, the Department of Health, the Department of Trade and Industry, as well as DOLE, DOTR, DILG, DPWH, the Philippine Sports Commissions, and the Games and Amusements Board issued a JMC 2021-0001 to provide specific provisions for implementing measures in various settings like communities, workplaces, business establishments, film and audiovisual activities, as well as physical activities and sports and inactive and public transport. Next slide, please. So there are actually several findings from studies conducted by different teams. Kasama na po yung grupo ni Drs. Chu et al. And this is published internationally. And they indicated that meron pong evidence that eye protection, such as face shields, actually are able to reduce 78% infection, such as through the ocular route, which occurs either by droplet or aerosol or self-inoculation. Dahil po pag nahahawakan po natin yung mata natin, syempre pwede mo doon pumasok yung mikrobyo. Likewise, they also demonstrated that the use of masks reduced infection by 85%, and physical distancing also reduced infection by 82%. With every additional meter of separation, producing even more protection, and data was able to support this distancing up to 3 meters. So sabi po nung authors, syempre wala pong nag-iisang intervention na pwede pong magbigay ng buong proteksyon. But of course, pag pinagsasama-sama po natin to, nakakatulong. And this is what we advise in our minimum public health standards as necessary for mitigation of transmission of COVID-19. Next, please. Meron pa rin pong study na conducted po in India, and this is actually a real-life demonstration where the use of face shields could have reduced exposure of field workers who were actually doing surveillance dun po sa kanilang mga communities. And this led to 62 healthcare workers who did not wear face shields, visiting almost 6,000 homes, no? Na 12 po doon ay na-infect nung wala pa pong face shield na ginagamit. Pero nung minandate na pong gumamit ng face shield itong mga community-based teams, 50 of the healthcare workers who were required to wear face shields, none of them were infected, as they visited almost 20,000 homes where almost 3,000 individuals tested positive for SARS-CoV-2. So dito po sa study na to, nakikita po natin yung real-life effect nun pong paggamit ng face shield. Nung wala pa pong face shield, may mga nai-infect na healthcare workers. Nung pong gumamit na sila ng face shield, kahit pareho po yung ginagawa nila at nagbabahay-bahay at nag-i-interview, wala pong nahawa sa kanila. So with that, no, dahil po sa proteksyon na maaring ibigay ng face shield at sa patuloy na pagdami ng COVID-19 variants na napatunayan naman nating mas nakakahawa, inirekomenda na ipagpatuloy ang pagsuot ng face shield sa labas ng bahay. So this is recommendatory, it's strongly recommended. Pero we submit na dapat po sana pag nasa loob po or indoors tulad ng mga establishments or workplaces ay dapat maging mandatory ang pagsuot ng face shield dahil nga po yung ventilation ay hindi po natin makontrol ng maayos. Habang mataas pa po ang bilang ng mga kaso ng COVID sa ating bansa at habang marami pa rin po ang hindi nababakunahan, we strongly recommend na mas maigi po yung magdoble ingat para maiwasan ang tuluyang pagdami ng mga kaso. Maraming salamat po.
Thank you, Doctora. Apparently, from up to now, since we started, there seems to be really, well, it weighs heavily in favor of just retaining the original protocols, social distancing, the mask and the face shield. And kung gusto mo talaga masigurado, in face of the danger of COVID-5, then we might add another layer, yung eyeglass, plus the face shield. Pa naman siguro kung hindi ka lang reckless talaga, you do not use your hands. Ako pa naman sanay ako dito, yung I play with my, nakita man ninyo minsan ang ano ko nakagano na, I don't know, but it's a bad habit. Kaya tinatalian ko na itong isang kamay ko para hindi ko na talaga mahatak. I accept your recommendation. This is the twice over na. So, I'd like to thank the panel, and I'd like to thank also that you recommended the safest way for the Filipinos. Salamat po. I salute you.